Hello, my name is Nicholas Cohen. I'm a third-year family medicine resident at University Hospital's Case Medical Center, and I'm presenting to you this multi-site implementation and evaluation of fmfocus, the Focus Obstetric Ultrasound for Family Medicine Residents Training Program. This is brought to you by the Family Medicine Residency Curriculum Resource, which is jointly produced by the Society for Teachers of Family Medicine and the Association of Family Medicine Residency Directors. This presentation and this project was a collaboration between myself and co-investigators Dr. Blavis, Dr. Lappin, Dr. McGee, and Dr. Tuggy. Our objectives are to define the need for training, describe the deficit in the literature, and highlight the absence of a clear policy, review the current context of ultrasound, not only for family medicine, but outside of family medicine in focused applications in other specialties, to become familiar with the training program we've produced and to understand how this study works, this study to implement and evaluate the curriculum at multiple sites across the country. We'll begin with this slide. This highlights the need for training in family medicine on prenatal ultrasound. This was the only study done of family medicine residency program directors. It was in 1994, published in the Journal of the American Board of Family Medicine. And it showed that a majority of respondents, family medicine residency program directors, indicated a need for training their residents in obstetric sonography. There's an enormous amount of literature to support the use of focus ultrasound outside of the radiology department by non-radiologists. But unfortunately, the majority of that literature has been published outside of the specialty of family medicine. Rather than evaluating family medicine physicians and residents, these studies primarily focus on medical students, on emergency medicine, and in critical care, as well as other specialties such as hospitalists. Only 1.5%, or 2 of the studies that were found in a literature review by the authors of 127 studies in the past 10 years, actually involved validating the use of focus ultrasound by family medicine residents or physicians. In addition to the deficit in literature validating the use of focused obstetric ultrasound for family medicine residents and physicians, there's also an absence of a clear and strong policy statement to support the use of ultrasound in obstetrics for family medicine physicians. This policy statement here is by the American Academy of Family Physicians, and I liken it to a Hallmark card in its well-wishing for family physicians to use obstetric ultrasound. As you'll see soon, it doesn't give us the support that's needed in the hospital setting when we're challenged in our use of focused obstetric ultrasound. This statement says that modern family medicine physicians require access to diagnostic ultrasound. So far, no specific statement in support of our use or how we would be credentialed. Obstetric ultrasound is an appropriate skill for family physicians, that the AIUM, the American Institute for Ultrasound and Medicine, can accredit physicians who are including family medicine physicians in obstetric ultrasound, and that though radiology departments might try to assert sovereignty and infringe on family physicians' use of ultrasound, nevertheless, there's a 10.2% of OB-capable family physicians report having privileges for diagnostic OB-GYN ultrasound. The statement goes on to say that obstetric ultrasound can have a significant impact on patient care, that it's readily learned, that machines are available, that it's accessible, and that being able to have skills in focused obstetric ultrasound by family physicians is highly desirable. The Society for Teachers of Family Medicine consensus statement in 2008 stated that basic prenatal ultrasound, which they state includes amniotic fluid index, fetal presentation, and placental location. They consider it a required skill that residents should learn prior to graduation. The statements I've given you from family medicine contrast significantly from other specialties. So while there's in the AAFP statement a suggestion that it's a useful skill, it doesn't actually define the training required for that skill or the credentialing possibility specifically for family medicine. The STFM statement, though it does say more strongly that it's a required skill, it lacks the force of a policy statement or a basis for credentialing physicians in family medicine. In contrast, the American College of Surgeons has taken really the lead among physician specialties in carving out a scope of practice for their physicians, in providing training to those physicians that can be competency-based and standardized across the country, and specifically providing a method for credentialing and attaining proficiency. They have what are called exported courses. It's similar to our ALSO course, where you can purchase from the National American College of Surgeons this curriculum. You download the materials. It has specific content and a syllabus for classroom instruction. There's modules that have to be done online along with post-test by each learner, so that by the end of this training, you are, according to American College of Surgeons, certified to use to use ultrasound in these specific applications if you pass the test. Along with American College of Surgeons is the American College of Emergency Physicians. They as well have taken a lead amongst physician specialties in carving out a scope of practice for their specialty and defining specifically the training required to attain competency and to maintain proficiency. In this amazing policy statement, the American College of Emergency Physicians in 2008 gives evidence for the specific applications that should be core for emergency medicine physicians. It has the support of the ACGME that considers ultrasound a required skill for emergency medicine physicians in training or residents. And it has the specific number of hours needed to teach these skills and the specific components of the training that should go into training residents. For everybody else, if you're outside of one of these two specialties, including family medicine or you're a sonographer, there are these requirements or these possibilities for credentialing. There's the American Registry of Diagnostic Medical Sonographers, or ARDMS, and there's the American Institute for Ultrasound in Medicine. These prerequisites are a minimum of 800 studies in the specific area that you're desiring certification, being in a residency or fellowship where the ultrasound was an integral part of the program, and successfully completing the ARDMS sonography principles and instrumentation, in addition to then going on to pass the test in that specific area that you're applying for. The American Institute for Ultrasound in Medicine requires either at least 3 months of diagnostic ultrasound training in residency, performance and interpretation of at least 300 scans, or evidence of 11 AMA PRA Category 1 credits in the specific modality of ultrasound that you're applying for, and evidence of being involved with the performance, evaluation, and interpretation of 300 scans within a 3-year period. I got this ARDMS certification, and so I can speak firsthand as to how beyond the scope the material is for what I will need as a family medicine physician. And I can speak to the challenges in getting that many studies done during a residency. The options left to family physicians without credentialing coming from our own specialty are an enormous obstacle to us being certified in the basic focused obstetric ultrasound that's required for us to provide the standard of care for our pregnant patients. And lastly, to bring home the point that training non-radiologist physicians in focused ultrasound with limited curriculum is feasible, there is an enormous body of literature validating the use of ultrasound by medical students with only limited training. In 2001, there were 350 studies involving ultrasound for medical students. In 2011, over 1,000. This now brings us to family medicine focused obstetric ultrasound. This curriculum that we've developed at University Hospital's Case Medical Center in the Family Medicine Residency Program is a blended curriculum with online training, skills practice, and laboratory sessions. We've had over 200 learners so far. You can see a significant knowledge gain from pre-test to post-test and a very high first-time pass rate on the hands-on evaluation. Learners also find this course very satisfying when rating the material in the course as how well it is to understand, in whether or not they'd recommend the course to others, in their overall rating of the courseware, and their overall rating of the course. fmfocus training program has now gone beyond the bounds of the family medicine residency training program at university hospitals and beyond the Case Western Reserve University School of Medicine OB/GYN rotation. The curriculum that we've developed has been accepted and is part now of the Society for Teachers of Family Medicine and the Association of Family Residency Directors Family Medicine Residency Curriculum Resource. The overall plan for this curricular implementation and evaluation and dissemination began with a presentation that was made in May 2013 at the Society for Teachers of Family Medicine annual spring conference. We've been enrolling programs so far, over 20 family medicine residency programs in this curriculum, so that between now, July 2013, and August 2014, these programs will have their learners participate in the online curriculum and will be centralizing results to publish later in the fall of 2014. Last month, we submitted a survey to SARA regarding the current state of training for family medicine residents in focused prenatal ultrasound. And finally, we hope that the results of this study will form the basis for a revised policy statement by the American Board of Family Medicine and the American Academy of Family Physicians, defining the scope of training and the process for credentialing family physicians in focused obstetric ultrasound. Now for some of the logistics of this curriculum and the study. Programs are enrolling their residents on a rolling basis based on how long it takes to get IRB approval or exemption. They're then having their residents complete online modules with post-tests. All the residents who complete and pass these post-tests are then able to download a hands-on evaluation form. Hands-on evaluation happens at each residency program. It's about 3 hours long, 1 hour for each of the 3 topics covered in the online curriculum. And learners are expected to be able to perform all the steps after being demonstrated those steps by a proctor. Each learner will then have a year to log 25 scans and have those 25 scans proctored by an individual who is performing ultrasound at that residency program site. Each month, the site champions for each of the programs will teleconference to be able to share data and see and measure learning curves across sites and across number of scans for each learner. Finally, each program site will have an OSCE at the end of the year once all of their learners have performed and logged 25 scans, and this will determine whether or not the learners are capable of accurately performing and interpreting the 3 focused applications of prenatal ultrasound. The specifics for data collection for this study are a baseline survey and online modules. We'll have data collected from the initial hands-on evaluations and for all of the proctored scans, as well as for a final OSCE, and finally we'll collect data using a survey at the end of the curriculum. In conclusion, there is a need for training and credentialing family physicians in basic prenatal ultrasound. You are participating in a multi-site implementation and evaluation of this standardized training program. We hope the results will help form the basis for a set of national standards for training and credentialing family medicine physicians. Thank you.